problem is, how are they going to pay for it? Well, the elephant in the room is Medicare, ladies and gentlemen. My generation, at 58, is getting ready to move through the Medicare cone. The government has no idea how they're going to pay for this. None. They just issued $8.8 billion worth of bonds to pay for the next 2 years of Medicare. They haven't got a clue what's going to happen after that. Okay? They haven't got a clue. Now, there is an estimate of what national health care will cost. Okay? And I love it when politicians do estimates. You're going to like this estimate. It's between $100 billion and $190 billion. Little room for some leeway there. Okay? 100 to 190 billion. The problem is that every time they estimate these programs like Medicare, they don't estimate them properly, and the next thing you know, we've got a huge problem because the money's not there to pay for it. So how are you going to put national health care in place for 100 to 190 billion and turn around and fund Medicare, which you don't have the money to pay for today, and the majority of us that are 58 or older are going to start moving through that cone? The money isn't there, ladies and gentlemen. It's not there. Okay? There is no there for national health care in this country. And if we move to this system, I have no idea how they think they're going to pay for it. And if you can't administer it and make it work in a country of 25 million like Canada, how are you going to make it work for 365 million people in the United States? Excuse me, United States. So that's Hillary, and that's Mr. Obama and what they have in mind for us and what they would like to do. What John McCain wants to do is totally different. John McCain wants to implement an association health care plan very similar to what Senator Talent, the former senator from Missouri, and Senator Enzi wanted to put in place. And that would allow you as businesses, if you're an optical shop, you could form an association of optical shops, and you could go out now, instead of having 4 employees, you could have 400 members, and you could buy an association health care plan. That would lower the cost, give you greater membership, and make sense. The other thing he wants to do is he wants to allow people to buy health insurance across state lines. Imagine what a guy in California could buy health insurance for if he bought a Kansas plan. Probably a little less than what it is in California. So that's something that he wants to implement. It would open up competition. The other thing he wants to do is he wants to give a $2,500 credit to individuals and a $5,000 tax credit to families so you can buy health insurance. So there are solutions out there. There are lots of solutions out there, and it's not rocket science. The problem is the politicians have to understand that the single-payer system is not going to work. You know, it amazes me when I go to meetings and I listen to what politicians talk about in terms of solutions, and everybody wants to have a solution. The problem is most of them don't know what they're talking about. What they're looking for is something they can hold up at election time and see, I did this. The problem is the I did this is not going to work. What we need are marketplace solutions, and there are marketplace solutions available. KHIA in Kansas, MHIP for the uninsured, association health care plans, tax credits, health savings accounts are phenomenally successful. People on the left said they were only for the rich. Kind of funny, 30% of the people that have signed up for them were previously uninsured. I guess they weren't so rich. Okay? There's a new bill in Congress now. The Democrats want to tag on to HSAs more regulations to make them more difficult to use so that the money in those accounts are going to be monitored in much more difficult ways by the IRS. What are they trying to do? They're trying to constrict it so that it doesn't work. They don't want it to work, because if it works, it proves there's not a crisis and there's not a need for universal health care. And that's what this is all about. You've created a crisis. Now that we've got the crisis, we have to have it. Remember the drug crisis with Part D Medicare? Senior citizens were eating dog food? Well, it's the same thing all over again. It's a crisis, okay? But the crisis isn't real. The solutions are there, and the solutions can be put in place to solve the problem. But free market solutions make a lot more sense. John McCain's got some very good ideas, and his ideas make a lot more sense than what Mr. Obama wants to do or Ms. Clinton wants to do. Government health care in this country is not going to work. Let me close by just quoting the Chief Justice of the Canadian Supreme Court. Access to a waiting list is not access to health care. Okay? She made that decision, she made that statement when she wrote the decision overturning the ability of the Canadian government to prevent private providers from opening up clinics and doing surgical procedures and other procedures in Canada. It was outlawed. It's not outlawed now. So her response to that was access to a waiting list is not access to health care. And I will close with this. Be careful what you wish for. If we go to a single-payer universal system and it's implemented, health care in this country will be delivered with the compassion of the IRS, the efficiency of the post office, and if you think it's expensive now, wait till it's free. Thank you.